Let's talk about the response evaluation criteria in solid tumor, also known as RECIST, response evaluation criteria in solid tumors. So whenever we treat a solid tumor, there can be response or there can be no response. No response is called a disease. So whenever there is response, it could be a partial response or a complete response. A complete response is said when there is disappearance of all target lesion. There is no lesion at all. No target lesion, disappearance of the target lesion. A partial response is at least 30% reduction in the longest diameter. 30% reduction in the longest diameter compared to the original or reference size or size when initially diagnosed before therapy. That is a partial response. And whenever there is no response or non-response, it could be a progressive disease or a stable disease. A progressive disease is said when the tumor size increases at least 20% from the original lesion. 20% increase from the original lesion. A stable disease is where you cannot classify it into a partial or progressive disease, partial response or progressive disease between those two. That is called a stable disease. So those are the response evaluation criteria in solid tumors. Remember the two numbers. If 30% reduction in size, that is partial response. If at least 20% increase in size, that is progressive disease. And if neither of the criteria are met, then that is a stable disease.